This is TTT Live. I'm Vidya Ramphal. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to Manager Corporate Communication at the Ministry of Health, Candice Alcantara.
Good morning. Welcome to today's virtual media conference, which provides the Ministry of Health with an opportunity to update you on the Ministry's COVID-19 response. As is customary, we have representatives from the Ministry of Health here to give us the latest information and answer questions on COVID-19. Today's panel consists of the Honorable Terence Deyalsingh, Minister of Health, Dr. Avery Hines, Technical Director of the Epidemiological Division, and Mrs. Betty Ann Pilgrim, National Administrator, Nursing Services. I am Candice Alcantara, Manager Corporate Communication at the Ministry of Health, your moderator this morning. And we go straight into the conference. I welcome the Minister of Health to present his opening remarks.
Thank you very much, Candice. Good to be back here. Good morning to Dr. Hines and Nurse Betty Ann Pilgrim. Good morning to ladies and gentlemen of the media and all of you citizens wherever you are listening. So today is Saturday, the 16th of October 2020. As I normally start off by giving you the global context, the global pandemic shows little or no signs of slowing down at this point in time. There are now in the world 39,706,000. Today is Saturday the 17th. Sorry, just got a correction there. Saturday the 17th. 39,706,602 cases around the world. So sometime over the next day or so, we will be touching the 40 millionth milestone. And why are we going to be touching that over the next day or so? The global number of cases up to October the 1st is now touching 400,000 cases per day. Before in these updates, I would have said that the data showed 300, 350. We are now up to a new benchmark of 400,000 cases per day. That is not a good place to be. So within the next day or so, we'll be touching the 40th millionth case. The number of deaths, 1,110,808. And our deepest condolences go out to all of those families. I want to touch on two issues today. Where we are with the vaccination drive in Trinidad and Tobago for both the flu vaccination, and where we are with the procurement of vaccinations for COVID. Because since we started the flu vaccination drive, some people, the feedback we've been getting at the ministry, people are asking, rightly so, whether this flu vaccine is effective against COVID. And Dr. Hines could probably go into some more clinical details. Let me say from the onset, the annual flu vaccine shot we are giving out now will not protect you from COVID. It is not a COVID vaccine. There is, at this point in time, no COVID vaccine that has been formulated that has passed regulatory muster. What we are doing now is giving out the annual flu vaccine, which is deadly. Remember, last flu season, 41 persons died. And in the same age group as the COVID fatalities, the elderly with pre-existing conditions like diabetes and so on. So what we are trying to do and advising people is to avoid what is called a twindemic. Having the same person come down with both COVID and the seasonal influenza, both of which are deadly or fatal, especially to at-risk groups. So we are trying to avoid that twindemic. This is the third week that we are into our flu vaccination drive. And to date, at the end of week 3, we would have given out 15,650 vaccines. That is not a good place to be, because we were hoping by now after 3 weeks, we would be giving out at least 10,000 per week. This week gone, we only gave out 6,789. I am particularly concerned about two categories: healthcare workers and our pregnant population. To date, only 637 healthcare workers have been vaccinated, which is a bit low, so I'm urging all healthcare workers to get vaccinated. It's a perennial problem every year to get healthcare workers to be vaccinated. You are on the front line. We have the vaccines for you. Take advantage of it. At our antenatal clinics, again, this is one group that traditionally we have had trouble convincing them about the need for the vaccine. We have given out 535. Dr. Hines will reiterate the point, hopefully, that the annual flu vaccine is perfectly safe for the pregnant woman and her fetus and her baby at any stage during pregnancy. Dr. Surju Singh was here a couple of weeks ago reiterating that point. So we would like to see, when we come back here next week, Saturday, that for this fourth week, we would have given out about 10,000 doses. So the flu vaccines are available to all, but we are focusing on the at-risk groups, that is, children between 6 months to 5 years, the immunocompromised, like those on cancer therapy, the asthmatics, the elderly. Please, please get vaccinated. It's an annual vaccine. Even though you got a vaccine in May of this year, that was for last year's flu. This year's flu is going to be slightly different, so the vaccine changes every single year, and I hope Dr. Hines will give you some more details on that. In my budget presentation on Friday, I alerted the country as to where we are with the procurement of COVID vaccines now. So I've left flu vaccines, I am on to COVID vaccines. At this point in time, Saturday the 17th of October, at this point in time, there is no regulatorily approved COVID vaccine. What we have signed on to in Trinidad and Tobago is a vaccine facility called COVAX, managed under WHO. What the COVAX facility does for any country that signs onto it, as we have done, it pools resources and it invests in a portfolio of promising vaccine candidates. So we are spreading our risk, not putting all our eggs in one basket by dealing only with one vaccine manufacturer. So under COVAX, that facility will deal with about 12 to 15 vaccine manufacturers, all of which have candidate vaccines, most of which are in either phase 2 or phase 3 of clinical trials, with phase 3 being the last clinical phase. In signing on to that, countries agree that COVAX is built on the issue of equity. What does that mean? It means that any country, regardless of income status, regardless of size, regardless of its geopolitical stance in the world, will have equal access to a vaccine once it has been formulated, proven to be safe and effective, and passes regulatory muster. The ideal between this is that COVAX and WHO, and we all feel it is better for all to have equitable access to vaccines around the world rather than all in one country. What is good for one has to be good for all. So, in signing on to the COVAX facility, any country, regardless of size, will get in the first instance 20 vaccines to cover 20% of its population. So whether you're a small country of 10,000 people or a large country of 300 million or 1 billion, you will get 20% across the board to vaccinate 20% of your population in the first instance. What does that mean for Trinidad and Tobago? 10%, our population is 1.4 million, so 20% of that is 280,000. So in the first tranche of the vaccination drive, we will be getting vaccines to vaccinate 280,000 citizens of Trinidad and Tobago. After that, in the second wave of the vaccination drive, Cabinet has signed on with COVAX to purchase vaccines for 33% of the population. 33% is 462,000. So after we get our first 280,000, we will then get another 182,000 to vaccinate 33% of the population. So that is how the COVAX facility works. And that is where we are with that right now. Some of the companies that COVAX is investing in, and I think the population and members of the media, you ought to know this, will be the AstraZeneca Oxford vaccine, the CanSino Biological Group, Gamaleya Research Institute, Janssen Pharmaceuticals, Moderna, you have heard about that, BioNTech, which is partnering with Pfizer, the Wuhan Institute of Biologicals, Sinopharm, and they have 2 vaccine candidates at 2 locations, and Novavax. Out of these vaccine candidates, for those who follow up the international news, I believe 2 of these have been paused because in the phase 3 trials, 1 person each in the phase 3 have come down with some sort of condition which has to be investigated. I believe that the AstraZeneca is 1 and 1 other. And that is the good thing about investing in a portfolio of candidates. It means if one shuts down for one reason, research and our access to other candidates goes on. So that is where we are with vaccines this morning. I hope I have been able to draw the distinction clearly between the annual flu vaccine, which we are giving out now. It is not for COVID, but it's to prevent anyone from getting 2 deadly viruses at the same time. And I think I have brought you up to date with where we are with the COVAX facility. Thank you very much, Ms. Alcantara.
Thank you very much, Minister, for reminding us of the importance of getting the flu vaccine, especially for those at-risk persons. And now we move to Dr. Hines, who will present the epidemiological update.
Thank you, Ms. Alcantara. Good morning to the Minister. Good morning to Ms. Pilgrim. Good morning to the members of the media and the viewing and listening public. Prior to the epidemiological update, I'm just going to run through the clinical update as it exists as at 4 p.m. on October 16th. So we do a daily update, and the daily update for today will be updated later today. So this is the update as at 4 p.m. October 16th, and it is as follows. To date, 31,343 persons tested, that is unique tests. Of those, 5,241 individuals that have tested positive. We have had 3,545 recovered patients. There are currently 1,601 active cases. And there have been 95 deaths, and we extend our condolences to the family members of those persons who have passed on. There are currently 98 individuals hospitalized. There are 43 patients in step-down facilities, and there are 244 patients in state quarantine, and 1,460 individuals in home isolation currently being monitored by the county medical officers of health. A further breakdown on the individuals that have been hospitalized at present. There were 61 in the Couva multi-training facility. Of those, 5 are in ICU and 7 are in HDU. At the Cora Hospital, there are 20 persons. Arima General, there are 3, 2 of whom are in ICU. At the Scarborough Regional Hospital at the Fort, there are 14 And of the individuals who are currently in step-down or transition facilities, of those 43, 26 are at the Claxton Bay Correctional Facility, and 11 are at the UEDB facility, while 6 are in Tobago. So that rounds up the clinical update. Just before I move into the epidemiologic update, I would like to re-emphasize some of the points made by the Minister with regard to the flu and the flu vaccine. The first and most important point is that the flu influenza in its various formats has been in circulation for centuries. We have had vaccinations that have been tested and that have been used in the human population safely for a prolonged period of time. This is not a new vaccine. This is a vaccine that has had its safety profile very well tested, and it has been proven to be safe for all persons, including pregnant women at any stage of their pregnancy. We have seen that the flu itself has caused illness and death, and that those illnesses have been more severe in individuals who have certain risk profiles. And the risk profiles are quite similar to the profiles of the individuals who currently have more severe illness with COVID-19. So older persons, persons who have what we call pre-existing conditions or comorbidities, things like diabetes, hypertension, asthma, anything that affects their immunity if they're on medications for transplants to prevent rejection, medications to treat cancer, anything that can reduce your immune system's response makes you more susceptible to more severe illness. So, as the Minister pointed out, we do want to encourage all persons, especially those in high-risk groups, to come forward to get their vaccination. And I'd like to reach out especially to my own colleagues, both the medical and nursing, all the clinical colleagues, all the frontline individuals, to get your vaccines, because it does help to reduce your own risk of illness. And at this point where we don't really want to have a respiratory illness or to be confused as to whether a respiratory illness is COVID or otherwise, it helps to unmuddy the water. It helps to make things a little clearer. And just to emphasize the need for the repeated vaccines, more so for the general public. One of the things that a vaccine does is it teaches your immune system specifically how to recognize one particular target. So the COVID vaccine, which is a different thing from the flu vaccine, means that the COVID vaccine will teach your immune system how to recognize the COVID-19 virus, completely separate from the flu vaccine teaching you how to recognize the influenza virus. And even the influenza virus changes continually, so that by the end of a year, it looks a little different to your immune system, and your immune system needs another primer, an updated vaccine, in order to be able to recognize and fight. So, those are the main points I wanted to re-emphasize regarding the influenza, both illness and the vaccination. I would now like to move to the slides that we prepared for, again, as at October 16th, for the epidemiologic update. So, first slide that we will see is the EpiCurve. The EpiCurve, as we've described, please, next slide. The EpiCurve, as we've described, takes the number of samples that have been tested positive, and it groups them according to the date on which individuals presented for swabbing. In so doing, it gives a better or a clearer pattern of when exactly people were ill in the population, and it removes the quote-unquote noise or distortion that may happen if there are any lags with regard to the date on which a result is published. So this graph is the one that we use to get a better idea of the direction of the epidemic, and what we are seeing from it is that coming down from the peak in late August or around August 25th, we have had a faster decline from late August into early September, and then a slower decline across September into October. Basically, it's sort of a flat line. If you look at that dotted line that's running through the graph, that means that we're sort of plateauing with regard to the number of new people testing positive on a given day. This has its own implications, which I'll circle back to, but I'm going to move on to the next slides, which show basically the demographics next. And the demographics remain as we have seen them in the past, with the largest proportion of individuals testing positive within that 25 to 49-year-old age group, the active adults. That's about 55% of the total COVID-positive caseload. The individuals under 25 are approximately 17%, and we have a slight preponderance, meaning a slight excess of males over females, of almost 53 to 47%. Next slide. With respect to the persons who have passed on, we see that those deaths occurred mainly in the older age groups, although deaths have occurred in age groups as young as that 30 to 34-year-old age groups. More of the deaths have occurred in men, and the 70 to 79 age group is the grouping that has the majority of the deaths, where both males and females in 70 to 79 age group have comprised the largest grouping in each gender. Next slide. The geographic distribution remains as we've described it in the past. Where there are people, there is virus. The distribution has followed the population distribution across population centers from the west through the east-west corridor to the boroughs and city centers in the east along the north-south meridian. Wherever there is a population, we have seen that there have been individuals with cases, and this also comes back to an implication that I will return to at the end of the EPI presentation. Next slide. This basically shows just the same thing but without the repatriated cases. Next slide. This graphic takes a different look. Instead of breaking it up into communities, it breaks it up into even land areas. The land areas in each hexagon are approximately 7.79 square kilometers, 8 square kilometers. So those hexagons represent even areas of land space, and you see that again, the distribution follows largely the population density, but you cannot find any place that there are people and no virus. Basically, everywhere that there's a settlement, there have been individuals with virus, and we need to bear that in mind. Next slide. So, actually, that's the end of the slides. So we continue. The main takeaways from the epidemiologic situation at present are as follows. If we're seeing a plateau, meaning we're not really going down very quickly, we're going down very slowly, if at all, it means that our behaviors at present in the population are just about keeping the virus bubbling slowly somewhere along the line. And what we would need to focus on as we enter this phase of trying to eliminate virus transmission is we really need to focus on what we call risk mitigation or risk reduction in our individual interactions. The only way a virus can be passed from one individual to another is if there is a risk involved where an ill person comes into contact with someone who's susceptible. So all of the practices that we've been encouraging are gauged at or intended to reduce that risk. We ask ill people to remain out of circulation. We ask all people, whether they think they're ill or not, to wear their masks when they come into closer contact with other persons. In so doing, even if you don't know that you are carrying the virus because you're asymptomatic, you're reducing your risk of expelling virus-laden particles into the air. We ask that individuals maintain that physical distance of over 6 feet so that any droplets that are expelled from your respiratory system can't get to another person. We ask that people maintain the hand hygiene and the respiratory etiquette, coughing and sneezing into something disposable or at least into the crook of your elbow, keeping hands clean, and all of these things. Although no one intervention is going to give you 100% protection, each intervention adds to your layer of protection until you have had a greater reduction of risk than if you did any one by itself. So this is why we continue to harp on and to encourage these fairly simple sounding measures, because as we add them up, their effects in reducing the risk of overall viral propagation are actually quite significant, and we have seen where they have been working. We just need to continue working with them, especially as we begin to consider moving around with a little more freedom. So that brings me to the end of the epidemiologic update and my summary on the situation as it stands. Back to Ms. Alcantara.
Thank you very much, Dr. Hines. And we transition very smoothly now into the presentation from Mrs. Pilgrim. She will focus on mask wearing, which is a critical element in the prevention of the spread of COVID-19. We go to Mrs. Pilgrim.
Thank you, Candice. Good morning, Minister and Dr. Hines. members of the media, and Trinidad and Tobago. Dr. Hines, I just want to echo what you just said. You said each intervention adds to your layer of protection. So as important as the wearing of the mask is, I would like to remind the public that mask wearing alone will not reduce your risk of getting COVID-19. You must also continue to take all other personal health precautions like hand washing, physical distancing, sanitizing services, practicing good health hygiene, coughing into your crook of your elbow, disposing of tissues into the bin, and washing your hands immediately. So now, my first slide. We all know that the masks do offer a level of protection to help stop the spread of COVID-19 to others. The CDC recommends that you wear masks in public settings, around people who don't live in your household, and when you can't stay 6 feet away from others. And as we all know, that compulsory wearing of the mask was made law in Trinidad and Tobago on the 31st of August, 2020. So how do you select and wear a mask? First of all, the mask, it is recommended that the mask that you wear, next slide please, must contain a minimum of 3 layers. The mask must also cover your nose, mouth, and be secure under your chin and at the sides of your face. Also, if you're 2 years old and up, you must wear a mask. So you don't need to wear a mask if you're under 2 years old. If you have trouble breathing, there are other devices which I will touch in a minute. And if you cannot remove the mask without assistance, and also there are masks that are intended only for healthcare workers like the N95, the public is not encouraged to wear those. So how do you wear your mask? So the mask that you wear must be worn correctly and consistently. So correctly means that it must fit around your nose, your mouth, cover your chin, and securely against the sides of your face. And consistently, if you are in the company of persons who do not belong to your household, you must wear the mask. Some people feel comfortable wearing the mask around friends, but that is not encouraged because you do not know, you may not know who has been exposed. So you must wear it correctly and consistently. Before placing your mask on, you must wash your hands with soap and water, or if you don't have soap and water, use a hand sanitizer that is over 60% alcohol. Do not touch the mask when wearing it, and even when you're placing the mask on, do not touch the inside of the mask. And again, ensure that it fits snugly against the side of the face and that you're able to breathe easily. So let's look at the next slide. Do not wear your mask around your neck. I've seen many persons wearing their mask around the neck. It's not a necklace. Do not wear it on your forehead. It's not a headband. Make sure, do not wear it under your nose. I've been doing my own little survey, and I would say driving down the promenade, 1 in 10 person would be wearing it properly. So do not, make sure that your nose is also covered. You cannot wear the mask over your nose only and under your chin. Not under your chin. It should not be dangling from your ear, and it should not be on your arm like a handbag. So let's quickly review. The next slide. Let me hear how do you wear a mask? So you cover your nose, your mouth, and it must be snugly fitted at the side of your face, and you must wear it in the public setting. They must be worn correctly for maximum protection. Don't put it around your neck, on your forehead, on your arm, and don't touch the mask once it's on. We wear the mask to protect others. So you have a mask on. So how do you take off the mask now? So when you're taking off your mask, if it's tied, you untie, or you remove it from behind the ear. If it's elastic, you have the straps, you remove it, and then you fold it, place it into a plastic bag, a Ziploc bag, or into a receptacle. Fold the corners together, and then carefully wash your hands Do not touch your eyes, your nose, or your mouth. Now, there are several different types of masks around, but before I go on to the next slide, I would just like to remind you that when you're wearing your mask, if you have to constantly touch your mask in order for it to fit properly, then that is not the right mask. So also men with beards. I've seen a lot of men with beards where the mask is just covering your nose and mouth. You must cover the beard as well. So it must fit snugly and cover all there. So the purpose of the mask, as we all know, is to keep respiratory droplets from reaching others. The next slide, please. But masks with one-way valves or vents allow air to be expelled through the hole in the material. This can result in expelled respiratory droplets reaching others. So the CDC does not recommend the wearing of these masks. Next slide, please. Some persons would choose to wear face shields. First of all, face shields were primarily for eye protection. They are not as effective as the mask and we are not sure of what level of protection, if it offers a high level of protection. However, there are situations where the wearing of the shields is needed. So for instance, next slide please, wearing of the mask may not be feasible in every situation for some people, example, people who are deaf or hard of hearing, or those who care for or interact with those persons. The evidence on face shield is limited and we do not have enough available data. But if you're using a face shield, you must wear the face shield that covers your face, has a hood, and covers your face to the sides, come to the side of your ear. These would offer a better protection and must come to the base of your chin as well. So that is a very quick roundup of wearing your mask. So Trinidad and Tobago, be safe and do wear your masks. Thank you.
Thank you very much, Ms. Pilgrim. And we go to the question and answer segment. Remind the media representative, state your name and the media house that you represent, please, before posing a maximum of 2 questions. Panelists are ready to receive questions, and we go straight to TTT this morning, please.
Hi, good morning. Sunil Lala from TTT News. Minister Dayal Singh, over the past few days, we would have seen a report that several nurses would have been quarantined after COVID-19 tests. Now, not directly on that, but do you have any data or figures as to how many healthcare workers in general, or frontline workers, have been tested positive for the virus since the pandemic started in TNT? And second question for me, you indicated that only 637 healthcare workers would have been vaccinated for the flu so far. Why is this a recurring problem every year? Is it that they are unwilling, they're afraid of the vaccine, or they're anti-vaxxers or something like that? Could you shed some light on this?
So thank you, Sunil. So I don't have a figure as to how many healthcare workers in general have been tested. What I do know, the situation at Port of Spain, because I spoke to the CEO this morning, 6 of those nurses have in fact tested positive, and all the positive nurses are being treated at the Arima Hospital. It has been a perennial problem in Trinidad and Tobago and some other countries to get healthcare workers to accept the flu vaccination. We have tried to find out why. The reasons vary, and even among the general public. So what we are appealing to all persons, healthcare workers, the pregnant population, the asthmatics, everyone, get vaccinated. These flu vaccinations, as Dr. Hines has said, they have been in circulation now for decades. Correct. Billions of doses have been administered. It has been proven to save lives. And let me reiterate, because this is the main question we get. If I got my flu vaccination last year, do I need to get one this year? And the answer is yes. It's an annual flu vaccination, because, as Dr. Hines says, the virus changes subtly from year to year. So the vaccine that works in 1 year will not give you total immunity or significant immunity for the virus circulating in the following flu season, because the virus would have changed, it would have adapted, it would have mutated. So it's an annual flu vaccine, and we urge everyone to get vaccinated. I would like these figures to go up to about 10,000 per week. It will help save a lot of lives and help save a lot of ICU and HDU space, which we want to reserve for COVID. Thank you very much, Sunil, for that question.
Thank you very much, Minister. And we go now to AZP News, please.
Hi, good morning, everyone. Priyabi Hari, azpnews.com. Minister of Health, I wanted to talk about the Trinidad and Tobago nationals who are stranded abroad. As you know, one of this group, the issue was mentioned in the UK Parliament this week. A lot of the nationals who are abroad still feel a sense of frustration that they are not getting the answers, they are not getting permission to come home. My question to you is the Ministry of Health considering a scenario where maybe the borders can be opened up for a short period of time to allow these nationals abroad to come home on a strict protocols, of the ministry, of course, so as to ease some of the frustration and the issues for nationals who are abroad? Is there any policy that the ministry is considering to have a more faster return of the nationals? That's my question. Thank you.
Thank you very much, Priya. The issue of returning nationals and opening the borders, the Ministry of Health continues to support the Ministry of National Security and the Honorable Prime Minister, who makes that ultimate decision. We have, I think, between 300 to 400 spaces that we could rotate every 10 days or so. And how many people do we have in those facilities now?
At present, 244.
So we have 244 right now. So we are, in fact, working with the Ministry of National Security to bring home batches of a couple hundred every 10 days. Because especially from where they are coming now, if they are coming from a high-risk country, we ask that they quarantine for 7 days. And then we give those facilities a couple days to what we call air out. We have to clean it and so on. So we continue to support the Ministry of National Security and the Honorable Prime Minister with health facilities to make those decisions.
Thank you, Minister. And now we go to 98.1 FM, please. Hi, Mr. Cummings. Just want to make sure that we can hear you. Make an adjustment on your end, I believe. We're still not hearing you. Let's try one more time.
I think he needs to unmute his mic.
I know Mr. Cummings is...
Yes.
Wonderful. Thank you.
Yes. Good morning to the panel.
Mr. Cummings.
And Minister Dayal Singh, Ms. Alcantara, and Dr. Hines, and Ms. Pilgrim. And I have my two questions. And before my two questions, Ms. Alcantara, I would have sent you a document. I hope that was received. Okay. Minister Dayal Singh, I'll start with you. I'm seeing now where increasingly technology and digitalization continue to play pivotal roles in adding another tier to effective COVID-19 contact tracing. Now, the World Health Organization has also lauded such approach when in one case they saw 1.2 million test results from the labs in Germany were made available in about 100 days. An example of an innovative measure. Now, how advanced are we with such regarding contact tracing in Trinidad and Tobago from where you are? Are we firmly seated on this technology highway that can help our situation? Maybe you can give an overview on that. And Dr. Hines, there is now what is being called long COVID. It speaks to long-term health issues among persons who would have either tested positive or have recovered. How concerned are you about what can be considered to be a potentially endangered subgroup of persons who may even have need for longer periods of monitoring? We have heard of cases of infection and reinfection. Thank you.
Thank you, Mr. Cummins. So I'll take the first question. On the issue of technology, we are currently evaluating 2 apps that we hope to roll out. However, Trinidad and Tobago's legal framework, how to put it, our privacy laws, our Data Protection Act, and so on, we have to see how that dovetails with the use of technology. I have noted that in many countries that try to roll out these apps, after the initial euphoria and good results, it was not sustainable because it depends on a certain critical mass of people willingly sharing their data. It's like mask wearing. If 50% of the people don't wear masks, then mask wearing it doesn't work. You need 95% of the people to wear masks. Similarly, with the technology that we have been looking at around the world, there are many problems and we are learning from those. So the 2 apps that are being evaluated this week, I believe, one is a local app and one is an app being prepared by PAHO. We will look at it. Hopefully we can roll it out in the context of our legal framework, because we have a written constitution, right to privacy and so on. Many other countries may not have that in their constitution. So we are trying to overcome these barriers, but as I said, we are evaluating 2 apps this week. As far as technology is concerned, we have upgraded our lab information systems at TPHL, CARFA, and all the other labs so that we could report results much faster after we did have that delay in reporting during the month of August. You would have noticed a vast improvement in the way we are reporting results because we have invested in software updates and some technology there. Thank you very much.
Thank you. And the second question?
Okay, thank you, Mr. Cummings. I'm actually going to tag on a bit to the Minister's answer with regard to the contact tracing, just to re-emphasize that the basis of any successful contact tracing, any successful epidemiologic function is really what we call the shoe leather function. First, we have to have it right on the ground. We can then speed it up, automate it via the use of technological platforms and applications. But the on-the-ground, the shoe leather process is in place and is working. It has been disseminated and distributed across the geographic subdivisions of the Ministry of Health, those county medical offices of health. And app or no app, the use of the individuals, the human resource, to do the tracking, to keep in contact with the individuals who have been identified either as positive or as exposed, that work goes on apace. The app will only help to speed up, but it is not, the absence of that at this point in time does not impair our ability to carry out those contact tracing functions. I just wanted to emphasize that. Now, on to the long COVID. Your question is, how concerned would we be about that subgroup of individuals? We are aware that there is a possibility that certain individuals may have a longer course of illness, a more protracted course of recovery. And because we are aware of this, we've begun to put facilities in place, including the clinic for monitoring individuals with protracted symptoms. And the concern, therefore, is really just that if individuals are experiencing these symptoms, that they are aware that they can come back to the health system and that they can continue to seek care. So we'd like to take the opportunity to advise anyone who has had COVID and is now having protracted symptoms that they can reach out to the health system via the CMOH, via the hotline, to be directed to the facilities that provide that ongoing follow-up. So thank you for the question.
Thank you very much, Minister and Dr. Hines. And we go now to CL Communications.
Good morning, everybody. Natalie Singh, CL Communications. I just wanted to find out one thing concerning the ambulance services. Has that service improved when it comes to responding to COVID patients? And then my second question concerning flu vaccination. Minister, you are not pleased with the number of people coming forward to get the flu vaccination. I just want to find out what is being done to sensitize the population about the importance of the flu vaccination. And then secondly, how dangerous is this precedent to have low numbers of people getting flu vaccination? Thank you.
Okay, thank you very much, Nadaline. Yes, we have worked hard with the ambulance system for COVID. Additionally, and when we did go out to procure these 10 ambulances, COVID was not on the radar. So I'm not trying to say that we brought in 10 ambulances for COVID. We didn't. Southwest Regional Health Authority last year would have gone out for tender for 10 new ambulances. COVID wasn't even on the horizon, so I'm not trying to piggyback on it. Thankfully, those 10 ambulances did come in maybe about a month or two ago, and that will help significantly with intra-facility transport of COVID patients. So that is what has been done. As far as sensitizing the population for flu vaccines, you may have seen we have launched both an aggressive mass media campaign, especially in the newspapers. We have done media interviews with Nurse Grace Sukchan on the radio. We are doing miking in the communities. We have done social media work. So we have done everything humanly possible to encourage people to come for the flu vaccines. What we are trying to avoid is for the public to hear that unfortunately someone has died of influenza, and then you get this mad rush and 40,000 people descend on the health system in one day. What we are trying to do now is get vaccinations up to about 10,000 a week without panic. If we can do that, and by the end of if you do that for 6 weeks, that is 60,000 vaccines. Currently, we are only at 15,650 after 3 weeks. So we continue to urge the public across all the media platforms, mass media, social media, newspaper ads, radio interviews, miking in communities, come out and get your flu vaccine. It is safe, it is free, it is effective, and it can possibly save your life.
Thank you very much. And we go now to TV6, please. Hi, Ms. Cutting, I think we're having a little difficulty hearing you. Just make sure that your mic is enabled.
Hello?
Perfect.
Hi, morning. Vanessa Cutting, TV6 News.
Morning.
Can the ministry advise whether TNT is self-financing its quota of vaccines through the COVAX facility, or whether we are being co-funded, and if so, to what percent? And is there any provision in this arrangement for countries to receive a refund should no viable vaccine be found?
Yes. So the answer.
Second question is, what is the advice to persons who have had COVID or currently still have COVID and are recovering or have mild symptoms, where it concerns getting this flu vaccine? Is there any concern that these persons may be considered immunocompromised?
So thank you, Renaissance. Yeah. So the COVAX facility does have a mechanism, and it's online, that if a vaccine isn't developed by, I think, 2022, countries can get back a certain percentage of the monies that we have paid. As far as Trinidad Tobago is concerned, we had to make an initial down payment by, I think, October the 9th, and I was told by the PS up to yesterday or day before that, in fact, we have executed our commitment to pay down part of those monies to the COVAX facility. I know that in the Caribbean, under another agency, they are willing to pay, I think, 10% of that down payment, but we had to pay by a certain date. And what I understand is that we can apply that 10% to when we have to pay for the actual shipment of vaccines that will come in. Okay, Renessa? Hope that answers my part of the question. I will turn you over to Dr. Hines for the second part.
Okay, thank you for the question. What the expanded program on immunization generally does, it's general advice that if anyone is currently experiencing viral symptoms, that they are not vaccinated with anything during that time period. So if someone is currently experiencing any viral symptoms, they would actually have to wait a few weeks before they then go to have their flu vaccination. So I think it's between 4 and 6 weeks. I'm subject to correction. Ms. Sukhchan can actually give us what the current country policy is. But the program for immunization generally gives the advice that if you're currently ill with a viral illness, you don't then go and add it to your immune stress by having a vaccination given at that point in time. You're encouraged to give it a few weeks to recover, to become asymptomatic, and then we can proceed with the vaccination to boost your immune system against a different pathogen.
Thank you very much. And we move now to Newsday, please. Mr. Lavond, are you ready?
Yes, I am. You hear me?
Wonderful. Perfect. Good morning.
Hi, good morning, Jens Lavand with the Newsday. I have two questions, one for Dr. Hines and the other for Ms. Pilgrim, Mrs. Pilgrim. Dr. Hines, you made mention that the infection rate isn't going down as quickly as you would have hoped. What is the current rate now and the projection for the upcoming week? And for Ms. Pilgrim, I know this question would have been asked many times ago, but up to recently, up to this week, I'm still hearing from nurses that there is a shortage of masks and gloves at the hospitals. Could you speak to that?
Okay, thank you for your question. So what we're seeing is what we call a rolling daily average. So we average 7 days prior, and it has come down to the high 40s at this point in time. It was 50s about a week prior, and it's continuing to come down. But the projection that we have for the end of this week is that there should be, compared to last week, approximately a 30-31% decline, depending on what the figures are that come in today. So we're seeing the decrease, but what we are pointing out is that because it's not as fast as it had been previously, that we are reaching a sort of a steady state, and it means we need to change some behaviors, enhance some protective behaviors in order to get it to go down further. So I'm hoping that answers the question.
Okay, so before we go to Nurse Betty Ann Pilgrim on the subject of PPE, let me state again, because there was a very unfortunate intervention in the Parliament yesterday. Some people are just bent on creating a false narrative about PPE. There was a parliamentarian yesterday questioning me during the Standing Finance Committee, given the impression that there was one, that we were not receiving PPE from the United States, and two, that healthcare workers and doctors in the public sector and nurses were not receiving PPE. When I questioned him, it turned out he was referring to his practice of dentistry in the private sector. Now, to link that, his private dental practice, where he is not getting PPE, to imply that that exists in the public sector was not helpful to the national response on COVID. When COVID started in Trinidad and Tobago, and my track record on these press conferences will bear me out, I said I took personal responsibility for changing the way that PPE was distributed. Before COVID, anybody could have walked into the stores department of any RHA and simply requested 10 boxes of this, 1,000 of that. We took away that system, and under my direction, we placed the giving out of PPE under the hands of the chief executive officers. It was based on recommendations from the Infection Prevention Control Committee that PPE will be given out to staff depending on their staff's level of exposure to the virus. So that if you're a frontline person during procedures like intubation, working in a COVID tent, you will get the highest level of protection. And then based on your risk exposure, you will be allocated PPE. There has been this unfortunate narrative from day one that we have had a shortage of PPE. That is absolutely false. What we are doing is managing the PPE so we don't run out. 2, there is no shortage of PPE in the public sector. As indicated by that parliamentarian yesterday, he is experiencing shortage of PPE in the private dental sector. I just want to make that abundantly clear, that we treat exposure to COVID by our healthcare workers with the utmost seriousness. And that is why we changed from day one how we give out PPE to make sure that it is reserved. The highest level of PPE is reserved for the persons at the front line with the highest level of exposure. Thank you very much.
Thank you. And we go to Nurse Pilgrim, please.
Thank you, Minister. And before I answer that question, I would like to state that I too have had the flu vaccine and I have had no negative symptoms. So I'm encouraging everyone out there to be vaccinated. Now, Minister, you've done an excellent job in answering the question, because everything you mentioned I have here, in that we don't have any shortage. We have had several meetings, including IPC officers, the CEOs, the general managers, together with the Ministry of Health executive, and we have had plans in place for distribution and also looking at the risk of exposure and so on for distribution of the PPEs. So to my knowledge, we do not have a shortage of PPEs. Thank you.
Thank you very much, Ms. Pilgrim. And we go quickly to AZP News for a quick follow-up question, please.
Hi, morning again. I just want to find out, just to clarify about the influenza vaccine. I, for example, had mine in December last year. Should I go now and get mine, or should I wait until December again? I just want to clarify when you should get it. You have to wait a year after the previous one, or should you go now and get a new one?
So it's an annual flu vaccine. So let me explain what the word annual means. It means it's not a calendar year. The flu vaccine runs from October of any year to May of the following year. So prior, that flu vaccine which you got in December 2019 would have been for the flu season that started in October 2019 and finished in May of 2020. What we are vaccinating for now is the flu vaccine season that started in October 2020 and will finish in May of 2021. So when we say annual, it's for the annual flu season, not a calendar year. So prior, yes, my brother, go and get vaccinated, okay?
Thank you very much, Minister Dayal Singh. And we are at the end of today's media conference. Thank you, everyone, for your participation. Please remember to protect yourselves and your loved ones. Get the new flu vaccine. We're focusing a lot on our children, our elderly, those who have hypertension and diabetes, pregnant persons as well. Very important. Follow the new normal guidelines and be safe. Trinidad and Tobago.
COVID-19 is here and has become everyone's business. It's not a respecter of age, race, gender, one's financial, educational status, or mental and physical ability. Therefore, it is our duty to prevent the spread of this virus in our communities. We all have a part to play with this pandemic. Therefore, there's so many things we can do. First of all, we can wear our mask, Practice good hand hygiene, that is washing your hands and hand sanitizing, as well as maintaining the social distancing at least 6 feet apart. Added to that, you can eat well, rest well, hydrate well. Ensure that you maintain your immune boosters by taking multivitamins. We, the frontline healthcare workers, need you to help us with this fight. To those suffering with predisposing health conditions like asthma, diabetes, hypertension, renal disease, autoimmune disease, just to name a few, take your medications as recommended by your health physician. Families, friends, I urge you to ensure that their supply is adequate. Do not let it finish. Also, take your recommended diet as per health condition. Do not cheat, for to cheat means you put your body in a difficulty to cope. To those persons living with depression, other health and mental health and emotional health conditions, self-quarantine is a difficult time. We know and understand this. I urge families and loved ones, do check up on them regularly. Send a voice note, make a phone call, extend your love, care and support to them as they do need your care and support at this time. To the youth of Trinidad and Tobago, do not think for 1 minute that you are exempted from this virus. I urge you to encourage good behavior amongst your peers. Do exercise good health practice and also ensure that you exercise the preventative health measures in this pandemic implemented for your benefit. I must add, in support of my health colleagues, we are committed to ensuring that you receive the delivery of care that is necessary to aid a speedy recovery for those who end up with this virus. Do act responsibly. Ensure that you maintain good health practices. Protect yourself and in so doing, protect your loved ones. For prevention is so much better than cure.